Welcome to the Breaking Pain podcast. I'm Dr. Zameer Pirani, an interventional pain specialist in Toronto, Ontario. This is where we break down pain, one conversation at a time, because your pain relief starts with your understanding. Today, we're tackling a big complaint I hear all the time in clinic. Doc, I have sciatica. Many people assume that all leg pain comes from that's coming from the back is sciatica, but that's not always the case. Two of the most common conditions that mimic sciatica are spinal stenosis and radiculopathy. How do you tell them apart? And more importantly, what can you do about it? If you've ever been told you have sciatica, or you believe you have sciatica, or you're just trying to figure out where your back pain is coming from, is it coming from your back or your legs, and your back and legs are miserable, then this episode's for you. First of all, I'd like all the audience to know that sciatica is not a diagnosis, it's a symptom. Sciatica is a condition characterized by pain that radiates along the path of the sciatic nerve. The sciatic nerve is a huge nerve. It's the largest nerve in our entire body. The sciatic nerve runs from the lower back through the hips and down the buttocks, all the way down each leg. Some symptoms, and remember, as I told you, it's a symptom, not a diagnosis, include pain that spreads from your lower back into your buttocks and down to the back of your leg, but that's not always the case. Numbness or tingling in the affected leg or foot, weakness in the leg or foot, or burning or shooting pain. There are different causes of sciatica, and those are things that I'd like to talk to you about. So that can be spinal stenosis, that can be radiculopathy. So spinal stenosis is pain that comes from compression of the cord here, where we see a lot of degenerative changes most commonly in our elderly population. And if you can imagine with this spine model, is that the space here gets much smaller and smaller, and patients will describe numbness and leg pain, and that can mimic sciatica. Another thing commonly is radiculopathy. So you can see this red part here, or in this spine model, the red part here is a disc at L3, L4. Sometimes the disc herniates and pushes down on the nerve that runs in the posterior aspect of our leg, and patients complain of leg pain. Another thing that I'd like to stress, especially in our young athletic population, is pain that comes from the muscle, specifically from the piriformis muscle. So piriformis syndrome can cause sciatica because the piriformis muscle lies right above that sciatic nerve that as it comes to our spine and to the back of our leg and to our buttock. Other things that can mimic sciatica where a lot of pain conditions coming from our axial spine right here. For example, facetogenic pain. So these are the joints here on our spine that allow us to twist and turn and bend backwards. They can often have referred pain down to their knee and to their thighs. Occasionally goes past that, but often patients may have facetogenic pain and they may complain of sciatic pain. The SI joint is less common, but this is the joints that hold up our pelvis. And often it can cause radiation or referred pain to the groin, but sometimes it can cause pain into the buttock and that radiates down towards the legs. And remember, not one single shoe fits all, especially in chronic pain. Pain is like Pandora's box, right? And so I've had many patients who have complained of sciatica. That's probably one of my most common complaints that I get in my practice. I had a young, very, very fit IT worker who sits at his desk, always sitting at his desk, is quite active, does some bodybuilding, and he complained of severe buttock pain that radiated down to his leg. After we've done a comprehensive pain consultation and physical examination, he doesn't have any features of a radiculopathy, or a pinched nerve, we should say. He doesn't fit the age category for spinal stenosis. But what he did have from his job and occupation, and also from some of his exercise habits, is that he had a tight piriformis or piriformis syndrome, and that was mimicking pain that was radiating down his leg. So the sciatic nerve was compressed by a very, very hypercontracted piriformis muscle. Differentiating that from a radiculopathy patients, as you can see from the spine model and this herniated disc here by the red, the disc herniates posteriorly and sometimes laterally and cause severe pain. And so this often mimics a certain nerve root. So L3, L4, L5, we have specific dermatomes that we can look at. The pain is actually much more severe generally if you have a true radiculopathy. And they typically complain of burning, pins and needles, sharp shooting pain down their leg. And what I often ask them in a clinical interview is I say, what bothers you more? Is it your back pain or your leg pain? So if it's a true radiculopathy, generally patients have sharp shooting pain down a specific nerve root that is so severe that they can't tolerate it. Some physical exam things that we would do to distinguish these two are, certain exercises that relax the piriformis muscle would reduce the pain temporarily. In radiculopathy, a straight leg test, so lifting the leg beyond 45 degrees causes pain for the patient. And those are two simple examination maneuvers that we can do to distinguish. But remember, in part of a comprehensive pain consult, we have to actually take all the patient factors into consideration. Is this patient previously healthy, fit and healthy? The age of the patient. What does the patient do for exercise? And then when we look at spinal stenosis, this is something that can also describe this, what we call the sciatica. That's, typically in our elderly patient groups. I always say to patients, you've had too many birthdays. And when that happens, we get degenerative changes. Degenerative changes is a fancy way of saying arthritic changes. And they essentially push on this canal right here, and they reduce the space. So the spinal cord has less, essentially, room to breathe. And that can cause pain that mimics sciatica. It can cause generalized numbness in no particular distribution. It can sometimes cause electrical pain, but numbness is more of a chief complaint. And you always have to take the patient's age into consideration. So it's unlikely for a 30 or 40-year-old young person that's been previously healthy to have spinal stenosis, although we have seen that occasionally in practice. So then, where do we take all this information? So do I have sciatica? What I really want you to know is sciatica is not a diagnosis, it is a symptom. And many of my patients ask me, should I get an MRI? Well, I think, in my healthcare system where I work in Canada, in Ontario, getting an MRI is not usually expedited. It can take months and months and months to get. Often, we take patients' demographics, age-related questions, symptom-related questions in a complete consultation. Sometimes MRIs are required. And really, every patient is different. So, a true radiculopathy, I think, patients should have an MRI. Often, if I think it's piriformis syndrome, things that we can get easier access to, like ultrasounds, can be appropriate. But that's a very difficult question, and I have to see each individual patient and look at it, each individual patient as an individual. Is an MRI going to change our outcome? Is it going to provide us with more information? A lot of questions can be answered with a history and physical examination, but for certain interventions, it is required to have some image guidance to help guide our interventions in treating the patient. So I'd like to just recap with some of the information that we've discussed. I always like to finish with, the top 3 things that a patient should take away. Number 1, not all leg pain is sciatica, and I want you to remember that it is a symptom, not a diagnosis. Pay attention to what makes your pain worse or better. Early treatment matters. The longer a nerve is compressed, the harder it is to heal. And so that should be taken really into consideration. And I really urge patients to try conservative measures in addition to any interventional procedures, because that shows the best benefit to patients. If you're struggling with back pain and want to know what really is causing it, send us your questions. We'd love to answer them in a future episode. Just remember, making an informed decision is the most important step. That's why we're here to break it all down for you. Remember, this podcast is only for educational purposes. Speak to your doctor for personalized information. Next time, we're diving into a big decision, when to consider surgery for back pain, and when it might not be the right choice. I'll be joined by Dr. Colby Ointman, a spine surgeon, to break it all down. You don't want to miss it.